I'd like to introduce Martha from Hawaii, who takes LDN for fibromyalgia. Thank you for joining me, Martha.
Thank you.
Could you tell us when you first started to get sick, when you first noticed that there was something wrong with you?
Well, there was a series of illnesses, sort of mysterious illnesses. The first was really very bad in sort of intestinal stomach acid kind of thing, atypical GERD, which then moved into chronic fatigue, which then moved into multiple chemical sensitivities, which then finally in 2010 roughly became fibromyalgia, and that was my primary. So when I first got sick, it was probably 2007. When my health started to deteriorate with all these sort of mysterious illnesses. And 2010 was when I really got sort of slammed with fibromyalgia.
Mm-hmm. So if you go back to thinking of your worst day, what would it have been like? What would you have had to have experienced throughout the day from when you woke up to when you went to bed?
Well, my worst day was when I was in a flare. Which pretty much I was bedridden. I felt very feverish, even though I often didn't have a fever. Almost any movement I did, there was pain. Really, my primary symptom was always pain. I did have fatigue, but the worst, so if I was in a flare, which I can specifically remember one, after I'd given a training, I'm a consultant and a therapist, and I had given this training for a bunch of preschool teachers, and I just started to feel so sick, and I was in bed for 2.5 days. Really not able to do much, including really eat. I couldn't really eat when I was in a flare. Days that I wasn't in a flare, by about 1 o'clock in the afternoon, it felt like I had the flu. And often I'd have to stop working or take multiple different drugs to sort of keep going and have like a full day of activity.
Mm-hmm. So when you weren't in a flare, how would you have rated your quality of life on a score of 1 to 10, and 10 being the best?
Well, I was lucky if it was a 4 or 5. That was a good day.
Right.
But I really had to, and I have my own business, so it was very difficult for me to continue to work, especially to listen to other people's problems when I was in so much pain. And at right about that time, in about 2011, my hip started to fail. So I had an exacerbation of arthritis, which seemed to go hand in hand with the fibromyalgia. So 4 or 5 was a good day for me. Mm-hmm. That meant that I was able to work pretty much until about 3. And, you know, being a therapist is not very strenuous. And my office is at my home, so I could walk to my office, I could sit down and listen to people, I could write up my notes, and I could end at 3, and it was a good day.
Okay. And you were saying about being in bed when you had a flare, but on a normal day, what would your sleep be like? Were you able to sleep at night?
No. No, just because I was in bed didn't mean I was sleeping. I was just in bed because it hurt to move, basically. Right? Mm-hmm. It just hurt to walk around. Even just the fall of my foot on the ground hurt me. So it was, but no, I did not sleep well. I probably had disordered sleep for several years before the illnesses started. By the time I had fibromyalgia, my sleep was very poor. Maybe I'd have 3 or 4 solid hours, and then I'd wake up in the middle of the night and often couldn't get back to sleep.
Mm-hmm. And how many drugs would you say you were taking at that time?
Well, I was juggling drugs. So I was taking opioids, and then I would take, and always in the background was a high dose of NSAIDs, so Motrin basically. So 8 to 1,600 milligrams of Motrin a day, and I was taking SSRIs for the fibromyalgia, and then I would vacillate between opioids for pain, hydrocodone, and I could only take it for a day, really, or a day, maybe 2 days, and then it would stop working. Then I'd juggle to another drug, sometimes Klonopin, or a drug called Soma, which is a muscle relaxer, and then I might have a couple of days that I didn't take them. So I was playing juggling drugs, basically, because nothing ever worked for more than maybe a day or 2. Mm-hmm. And then it would stop working.
And what about your appetite? Were you able to eat normally?
No. I mean, and by that time I got off gluten and dairy when I first started getting ill with my stomach problems. So I had really tried nutritional avenues. And I was getting regular massages. I was doing a lot of things for my health. I probably still was able to walk about a mile a day. I made myself walk about a mile a day. But yeah, no. My appetite was not normal. I didn't really lose that much weight because my metabolism wasn't normal either. Mm. So, but I tried to maintain some kind of health regime, through this illness. And I did, by sheer force of will, sort of make myself do certain things. But so I didn't really gain any weight, but I didn't lose any weight because I just think my metabolism was very disordered.
Mm-hmm. And how did you hear about LDN?
Well, I actually heard about LDN in 2006 from a friend of mine who was working with Dr. Jackie McCandless, who actually is from the little community that I live in on the Big Island. She recently passed away, but she had used it for autism, and then she had started this study in Africa using it for children with HIV. And this friend of mine who had found Jackie for her child with autism, I had worked with her and her child for several years, and she was a friend of mine, and she told me about low-dose naltrexone when I started to get ill. Back in 2007. And I looked it up and, of course, looked up naltrexone, not low-dose naltrexone, and said, why would I want to be on this? And dismissed it. And then in 2012, through my work, I read lots of mind-body medicine journals, and I came upon the interview in Alternative Therapies written by Julia Shopik with Dr. Bihari. And at the time that I found the article, I had basically about 3 weeks before said, this is it, I'm off these drugs. I'm not taking these drugs anymore. If I have to go to bed at 1 o'clock, I just made a decision that my quality of life was so poor and the drugs were making it worse. I just felt the drugs were making it worse. So I just decided a month before I found the article that I was not going to be participating in this crappy treatment of my condition, that I was just going to live with it and accommodate it and try to have a good life no matter what, right, even if I had to stop working at 1 o'clock. So about 4 weeks later, I saw the article, and I knew right away when I was reading the article, I said, this would work for fibromyalgia. And I went online and found the 2 studies by Younger and Mackey online with fibromyalgia. So I knew right away that my hunch was correct and that it stood a chance of helping me. So I took it to this woman's health doctor who I had a very good relationship with and said, put me on this. And she said, okay, I will.
Oh.
So that was 2 years ago, exactly in April, right about exactly 2 years ago, April of 2012. Mm-hmm. 2013. And probably about 3 weeks later, I started to have a response where really the pain was decreased significantly to where I'll never forget waking up one Saturday morning and being like, it was almost like I was a different person.
Wow.
Like the background noise, of my pain was gone.
Mm-hmm.
Yeah, so.
That's amazing. So after, let's say 3 weeks, were you able to sleep better?
I don't know if that exactly happened then. Really what I noticed was probably a period of about 6 weeks where not only did my fibromyalgia, the pain get really turned down, but I noticed that my arthritis, which had really gotten bad, I could hardly get out of bed at night to go to the bathroom, right? Mm-hmm. I mean, I was like creaking to get out of bed, that I was moving so much better first thing in the morning and in the middle of the night. And then the really most surprising response to me was that I had really felt this lifting of this lifelong depression, anxiety thing that I'd had. And really it felt very much like a lifting of that for the first time ever. And I wouldn't have said I was depressed before I started taking LDN. I really didn't think I was. I had been in my life before, but I wasn't on any antidepressants except for the fibromyalgia.
Mm-hmm.
And I wouldn't have said I was depressed. But this was really the most astounding response for me, not only the fibromyalgia, but the depression and anxiety thing. That was amazing.
Okay, and if you had to now, today, rate your quality of life on that score of 1 to 10, and 10 being the best, what would it be?
Oh, it's definitely a 10. I have a grueling schedule. I work for a very large Hawaiian-based preschool as a consultant. Last year I flew 30 trips inter-island, 3 trips to the mainland, and a 3-quarter therapy practice, which is my own business. I rarely get sick. I got sick once last year when my brother died very suddenly, which was stress, I know. And I used to get 5 sinus infections a year and have to be on antibiotics. And so I'm in preschools. I'm in germ factories. So I don't, I just think my quality of life is amazing, and I'm amazingly productive. So it is, I'm a walking advertisement for LDN, really, because I am so productive.
And what other drugs do you take now?
Well, I don't really take any other drugs. I usually take 2 L-tryptophan sometimes at night. If I do wake up in the middle of the night, if I'm still awake after half an hour, then I'll take a couple of tryptophan, 500 milligrams. And I take a Zyrtec, an allergy pill in the morning, which is an over-the-counter. Occasionally, because we have an active volcano on the island that I live on, and sometimes the volcanic emissions can get very bad. When they get bad, I have a little bit of exacerbation of inflammatory asthma, so I occasionally take an inhaler for that. Other than that, that's it. Mm-hmm. And I'll be 59. That's it. I don't take any other medications. Just PRN inhalers for asthma, and I take an over-the-counter Zyrtec. I do take bioidentical hormones, which I started 15 years ago, and every year they're checked. But I don't take any other medications. Mm-hmm.
You said that you were only sleeping 3 or 4 hours at a time. I know you said that you sometimes wake up still, but what would you say?
Well, my sleep has been healed. I mean, my sleep has definitely been healed. I used to have to take some kind of sleeping medicine almost, 4 times a week. And when I travel, I would definitely have to take something. And now I can travel without it. Like I said, I do use L-tryptophan sometimes, which works very well for me to put me to sleep. It's an amino acid, L-tryptophan, and it's over the counter. So I take that with me, but I can sleep. I can sleep now. I often sleep through the night. If I wake up, occasionally I will be awake, and then I listen. I have a whole listening thing in a listening device, like a meditation things that I listen to. But yeah, my sleep has been healed. There is no doubt about that in the 2 years I've been on LDN. But I can't really remember exactly when my sleep started to really get so much better, because it was gradual. I think probably the sleep was the last thing that really sort of got healed, because it was much more gradual. The pain lifting, the arthritis, then my depression and anxiety, those were all dramatic because I could feel them, right? They were dramatic to me. The sleep was much more subtle.
Okay.
But the other thing is I'm active now, right? I walk 5 miles. Occasionally I walk 5 miles and bike 5 miles a day. So I'm physically so much more active. So I'm tired.
Wow.
I mean, that's been the hugest key is I can move now a lot every day.
Now, you're doing wonderful things with LDN in Hawaii. Would you like to tell us about that?
Sure. So once I had this really, for me, surprising result of the depression and anxiety, I became quite interested in why this would have happened, and really began to spend all my free time on the internet trying to find something that would explain this puzzling response that I'd had, right? And so because I've worked in early childhood for many, many years, I pretty much went to my go-to study, which is a study called the Adverse Childhood Experiences Study, which was originally done at Kaiser in California, and now it's at the Center for Disease Control. And it's a study that with a very large sample size, 17,000 people. And it really was the first study that ever linked adverse childhood experiences with adult diseases, not just mental health problems like addiction or depression, but also physical health problems like heart disease, obesity, stuff like that, right? Stroke, increased morbidity and mortality. So when I was poring over all these documents, because there's been lots and lots of spin-off studies from this original study, I came upon this explanation for adult diseases, which almost perfectly matched the explanation in the Younger and Mackey studies for fibromyalgia. It was almost as if they both got them from a book, which I'm sure they didn't, but talking about microglial inflammation, that the microglial cells in the nervous system turn into these pro-inflammatory cells that produce these cytokines, and that causes this widespread inflammation. And this seemed to me to be a really good explanation for why. So I kind of, it was really for my patients. I had been using the ACE screener anyway, and in the study they talk about, so the ACE is the Adverse Childhood Experiences. It's called the ACE study. They have a screening tool, and it's very, very simple. And if you have 4 or more ACEs, you're in a much higher risk category. That's what they found in this study. And so I began to think, well, you know, if you have 4 or more ACEs, what you really have is chronic hypercortisolemia in childhood, like chronic dysregulation of your nervous system. So once I had sort of a working theory based on a very solid study, this ACE study is a solid study, I thought, you know what, I can write a paper and see if I can get some physicians interested in prescribing LDN to my patients, right? So I used this screening tool to decide who might be a good candidate, which would be 4 or more ACEs. And when people were interested, and many of my patients were interested, many of them, you know, they were not on any other drugs because they didn't want to take antidepressants, or they tried and it didn't work, or, you know, so I very quickly recruited a couple of physicians, especially the one that I had worked with, Dr. McGaff, who had seen my incredible progress. And so probably within maybe 2 or 3 months, I had recruited at least 4 or 5 physicians up here in North Hawaii willing to take my patients and possibly look at prescribing it. So that was, I wrote the study in July of 2013, and just this past weekend, we, the Hawaii Island Psychologists Association put on an information panel about LDN. We had 3 physicians on the panel, a naturopath, a psychiatrist, and the woman's health doctor that I had worked with, and 35 people in the audience, mostly therapists, but a couple of physicians and a couple of licensed nurse family practitioners. And there was a tremendous response in the audience, and a couple of people in the audience had been prescribed it by other doctors who had gotten a hold of my paper. So I think the paper itself is circulating. I have gotten a couple of phone calls from physicians in other parts of Hawaii, and I know that my patients that have traveled to the mainland or moved there have taken the paper to other physicians over there, right? So very quickly it's caught on here in a way that has been quite astounding. And so I do know that there are an awful lot of people now who are on LDN because their physicians got a hold of my paper and felt okay enough, because my paper had a lot of references in it that they could just click through, right, and find the studies or find this or find that. My paper was just my story, and talking about the Bihari interview and talking about, you know, the mechanism of action of LDN. So I really do believe that LDN holds great promise for people with so-called mental disorders, especially people who've had significant child maltreatment. Now as adults, often they have multiple mental health problems that are poorly treated with typical medications, and the medications have a lot of unwanted effects, which are what other people call side effects. And LDN, my patients who are responders on LDN, they look different. when they come in and they're starting to respond. I can see it in their face. I can see it in the way they talk. Their voice changes. I have several phone clients that I don't see face-to-face very often, and I can hear it in their voice. It's like their voice becomes less scratchy and less kind of, I don't know how to describe it exactly, but their voice gets a more melodic quality to it when they're starting to respond to LDN. And I can also tell when they go off it. I had one patient who was a responder, and I hadn't seen him for a couple of weeks, and he came in looking really bad and feeling really bad. And I thought, oh, my golly, the LDN stopped working. And then within 5 minutes, he said, yeah, I haven't taken my LDN for a couple of weeks because I haven't been able to get a hold of it. And I was like, oh, that's why.
Wow.
So, yeah. So I'm very, very excited about the possibilities of what LDN can do for our adult population that is really chronically dysregulated and is having disease because of it.
Mm-hmm. The doctors that are prescribing LDN in Hawaii, do you know if they're prescribing it for all the autoimmune diseases as well?
Yes. And that's one of the doctors on the panel, that naturopath that I work with, she knew about LDN, and that's what she prescribed it for, was autoimmune problems. Mm-hmm. So when she read my paper, she said, Martha, now I'm kind of getting the whole, what she called PTSD arm of it, right? I wouldn't exactly call it PTSD. I'd call it more chronic dysregulation. But yes, they are prescribing it for autoimmune, for chronic fatigue, for fibromyalgia. I even went to a gastroenterologist a little bit, our gastroenterologist in town, and he has a couple people on it for Crohn's and ulcerative colitis.
Hmm. Well, that's amazing. Well, we'll have to do a follow-up with you, Martha, next year and follow the progress of what's happening with LDN in Hawaii.
I hope we have great things to report from you, because we've definitely become a little mecca of LDN work here in the big island of Hawaii, in North Hawaii. So I'm hoping we'll have something good to report.
Wonderful. Thank you very much for sharing your experience with us.